If you guys who don't know me, my name's Elliott Reid. I'm an osteopath, 16 years worth of experience, and I'm the founder of the Revitalize Clinic, where we've helped now over 15,000 people become closer to being pain-free, mentally well, and physically fit. Now, what we work as osteopaths is we are essentially health focused and we are person centered, as opposed to a traditional Western medical model, which is more disease focused. So the Western medical model is perfect when it comes to your problems being centered around a disease. So something which is findable via a scan or via something down to physiological causes like bacterial infection, viral infection, a broken leg, something like that. However, osteopathy, our philosophy is to go towards health, not just to find disease. So you might see, or you might think of health, for example, as being different from just the absence of disease, right? So if I asked you, for example, do you have a current viral infection or bacterial infection, you might say, do you have a broken bone? No. But then I might also ask, okay, in the absence of disease, do you feel well? And you might say, yeah, but maybe a little bit more of a difficult question to ask, because when we look at things as a whole, we can't just take out what we don't want and then think by default we have everything that we do want, right? So that's where it starts to become much more person-centered. Now, one way of looking at your health is that it's a garden. It's not a disease, it's not a machine to fix. Your health is a garden. We are of nature. We come from nature. Nature flows through us, and we come from nature. Now, just like, for example, a garden isn't just healthy if there's an absence of weeds, a garden needs nurturing. And when we look at ourselves as a whole, there are many different sides of our health that we need to nurture to be well. I'll give you an example. The leading correlation to back pain in the UK is high blood pressure and type 2 diabetes. Right now, the obviously high blood pressure, cardiovascular system, type 2 diabetes is your endocrine system. There's an indirect correlation to back pain, but the correlation is the same things that lead to disease in some areas of our body lead to disease in other areas of our body. For example, being sedentary and having a high inflammation or high inflammatory diet, i.e. a processed food diet, leads to both high blood pressure and type 2 diabetes and back pain. And the reason for this is maybe it's best to look at our health or us as individuals as more of a spider diagram rather than something which is cause and effect. So I'll give you an example. I had a client who came in and they had severe hip pain, couldn't sleep, couldn't walk, and they don't know why it happened. You go back through the medical history, there's no trauma, nothing's really changed. So one question you could ask someone is, what led to your hip pain? I don't know. You then open up the question and you ask, tell me the story around what was happening in your life when your hip pain started. And his wife had been diagnosed with terminal cancer. Now, it's very, very common for pain to also be triggered by emotional factors in our life. And the reason for this is pain is a defense mechanism. Pain is a way of defending you against yourself. Anxiety is a way of you defending yourself against your future. Inflammation is a way of you defending yourself against physiological stress, which could come from diet, being sedentary, it could come from lack of sleep. But also, as well as that, pain is there to defend us when our nervous system thinks that our capacity to exist is threatened. So now our body has to kick in to defend ourselves, to make us more apprehensive, to make sure that we don't get ourselves into trouble. So hence, we look at individuals as osteopaths, we look at individuals more like a spider diagram rather than cause and effect. We are looking at how this person is actualizing their entire potential of health and then using that client as, or having a conversation with that client to understand what they feel might be interacting with their pain and also what they're willing to do about it. So questions that we could ask, we can do this as a group, is, okay, number one, so sleep. Sleep is a way of your brain recovering from the day or from the month, but it's also linked to high levels of inflammation if you're sleep deprived, high levels of irritability and anxiety if you're sleep deprived. So do you feel that you are well rested when you wake up from sleep? Yeah? Perfect. So here we could say that you're, say, here or here. Perfect. 2. How much would you agree with this? You can rate the statement as true out of 10. So out of 10, how true is this statement? The majority of foods I eat look like they could have been picked fresh from a farm or from my garden. Out of 10, what would you say?
Well, 1 is the most.
1 is the least. Yeah, 1 is the least. 5?
I'd say about I've got an allotment, so it's about maybe 6 or 7.
Good. About 7, yeah? So about 75 years ago in the UK, about 80% of our diet would have been unprocessed. Now the average is the opposite. About 70 to 80% of our food is processed. So when you look at how our health has changed over time, we've become more sedentary because of technology, and we're consuming much more processed foods. And then we wonder why, for example, the rate of diabetes, cholesterol, high blood pressure is going up. Yeah, of course, not a problem. Number 3. So how true is this out of 10? I regularly take time outside of work to build my strength. Sometimes, okay. Once a week. Okay, so out of 10, so ideally we'd be looking at about 3.5 hours a week, ideally, of intensive exercise. So if that's 10, what would you guys say you are at the moment? Yeah. About 5. Sorry, about 5 or 5, yeah? Cool. So when it comes to muscle mass, we might be around this area here, yeah, knowing that it tends to reduce over time if we don't practice it. Number 4, I see my friends regularly. Great. Somewhere, yeah? In the mixture. Okay. So the reason why we're talking about these two is these signal to the brain your capacity. If you practice strength and you've got good strong bone structure and good muscle mass, the nervous system doesn't feel like it needs to protect you as much because you're robust. It doesn't need it to kick in. At the clinic, we're seeing a lot more people, especially over about 50, 55 years of age, who are in a lot of pain, and they also score in around the lowest 5 to 10% of the population when it comes to their strength. And the two are very much correlated. When it comes to seeing your friends regularly, if you think of a group of chimps together, I'll give you a clue, sitting on a branch, back in single file, what are they often doing? Grooming. So we're very, very closely related to chimps, very closely related to other primates. We heavily rely on our social support systems, right? For example, another population of people that we see, people who recently moved to Gravesend, they've recently had a child, and their families are 150, 200 miles away. The amount of stress that they experience is far greater than those individuals who have their family near. But also, loneliness has a very, very high correlation to physical pain and mental illness. Number 5, I feel very well supported by my friends and family. Great. Number 6, I find work rewarding. Perfect. So what we've covered here is your social actualization, dietary, sleep, and the actualization of your physical capacity. If these things are starting to drop, especially if they have dropped within 3 months to a year proximity to pain or disease, that's when we start to look at trying to increase these, because we can increase your robustness. Now, this as osteopaths is us finding health. Yeah, so your doctor or your nurse or even your physiotherapist might take care of disease. We're really interested in taking care of health, because as soon as we take care of health, now you're self-sufficient. Yeah, someone who might be on high blood pressure medication, metformin for diabetes, ramipril, ibuprofen, paracetamol, all these things, they're treating disease. Great, because we need that when we're undergoing acute stress and we need to protect ourselves. But after we've done that, if we don't go towards health, we're losing our self-sufficiency. All right. Now, the difficulty with health. Can I use this? Is that all right? Yeah. So in fact, we'll use this together in a second. So the difficulty, yeah, I'll use this in a second. The difficulty with health and everything I described is a bit messy, right? If I'm saying go towards health, it doesn't really give you a very accurate idea of what you want to do. But the thing within us, which is developed by about the age of 7, are our values. And our values tend to be our guiding star throughout our lives, as long as we're in a situation where we can listen to them. So acceptance commitment therapy, up there with cognitive behavioral therapy, is one of the best researched methods of psychotherapy. Something I trained in when I realized that a lot of my clients were really struggling with motivation, with mental illness around their pain, and really struggling with how they can guide themselves forward towards their health based on their values. And what we can do is really shape our health and how we practice health around our values. Now, this is a very common framework with acceptance commitment therapy. Someone's values might be that they value nature, they value time outside, they value spending time with friends, they value kindness, camaraderie, or it could be the opposite. They might be very gladiatorial. They might really value their individualism, their ability to get ahead as quickly as possible. Now, these people, when it comes to a choice point, which is the stress that their environment places on them when they have to make a decision as to how they respond to it, if they are experiencing a certain drag from a social norm, which could be, for example, it's bad to be individualist. So say, for example, you come from an Eastern culture and you're living in the West and you're living with your family, and the Eastern culture is more collective. But now you, as a child, have grown up in a more individualistic society. You take on those values. Like, I'm going to get ahead. I need to do what's best for me. But the collective family might be like, no, no, you need to kind of toe the line. You need to do what's best for everyone. That might create some social conflicts. That person is driven away from their values. It could be that someone has extremely long work hours and they've dedicated themselves to a job which would make their family happy, but it means that they can't spend time outside. So they're once again being fused away from their values. Now, what we do when we use acceptance commitment therapy to go towards health, i.e. go towards someone's values, is we help someone to unpick their path away from their values, going back towards their values using very specific strategies. Now, the reason why acceptance commitment therapy, and it was included in the name, can be very effective is because life is tough. To live is to suffer, as the Buddhists would say. And pain doesn't have to equate to suffering. A lot of the time, if we can live a value-based life, what causes us distress can be manageable if we're able to live a life true to our values. So that means staying true to ourselves, staying true to our ideal selves, carrying our pain on our journey, or discomfort on our journey, or difficulty on our journey towards our values, but ultimately leads to the question of what kind of person we want to be. So a question that I might ask you guys to really tap into your values is, after you have left the room, what would you like people to say about you? Yeah. So that's a good question, because what we can do is separate work from family life, from social life, those kind of things. So we could say at work. So competent, knowledgeable. Yeah, perfect. So yeah, okay, great. So then, Carol, isn't it? Carol. So how would you feel if someone questioned your competence? Right. And how would you feel if someone supported your ability? Yeah. So, but then there's other people who might not really care. Right. So that's very true to your values. So anyone else? Any other suggestions? What would you like people to say about you when you leave a room? I'll bring up a slightly larger question in a second.
Professional.
Yeah.
Knowledgeable.
Yeah.
Approachable.
Great.
Working, yeah, that kind of thing.
And the beauty of all these things is you're in absolute control of every single one of them. Yeah, so we are as individuals, we're in control of our competence because we can learn, we can work hard, we can do our best, we're in control of our professionalism. So that's why also working true to our values can give us a lot of safety and a lot of security, because we're grounding ourselves in something which can't be affected by the external world. All right. Now, this framework of thinking, or this strategy, flows throughout all areas of our lives. For example, when it comes to sleep, to get a good night's sleep, the basics are pretty well established. You sleep in a cool room, it has to be dark, you do something relaxing before you go to bed. Supplements like melatonin, calm, ZMA, lavender, even rosemary can be quite effective at helping us sleep. And the general rule of thumb is that even if you are not asleep for 8 hours, you try your best to give yourself the opportunity to be in bed for 8 hours. Even if that means that you're just dipping in and out, that's absolutely fine. All right. But when it comes to what can distract us away from a good night's sleep, that starts to become a little bit more complicated. If it's noisy on your road, if someone's pissed you off during the day, if you have a partner who snores, these are all things. These are all things which can take us away from the ideal. So then we can start to unpick these things as individuals to bring us back to the ideal, whether we have eye masks, ear defenders, whether we have to negotiate about sleeping in a separate room from time to time. These are all things that we could potentially work on. All right. And the same is true for our physical health. Carol, you said speak for yourself when you mentioned that you're, yeah. So so that means that Carol, for example, would have a high level of NEAT, non-exercise activity time, because you tend to be up out of your chair a lot. Okay. All right. Okay. Fine. So we've got a potentially a high level of NEAT. Could be better. Megan, NEAT, non-exercise activity time, could be better. Alan, could be better. Okay, fine. So an easy way to tell this is your steps. Yeah. So if you got an app on your phone, if you're not reaching about 10,000 steps a day, then it indicates that you could probably be moving quite a bit more. And 10,000 steps a day, it's not too difficult to attain. Especially, you can literally park your car on the way home from work and just do a couple of walks around the block, and you're probably going to rack up your NEAT quite a bit. Or even if you take your lunch on the other side of the building or something like that. But NEAT is the bottom of the pyramid. It's the foundation for health. It's just locomotion. You're just generally moving, right? Up above that is strength training, which is what we mentioned before. Cardiovascular and flexibility is actually not the most important, because you tend to get a lot of cardiovascular benefits from strength training. Also, strength training is the thing that is most likely going to protect us as we get older, because a lot of people suffer from long lays, or a long lay is basically where you fall over and you can't get up. And that can lead to tissue breakdown and kidney overload. That's why, unfortunately, so many elderly people are found after days of not being able to get back up, and they're found passed. And it also protects us from breaking bones, which means that we're less likely to have a long stay in hospital, which could reduce our cardiovascular fitness and ventilatory fitness and all that. And then at the top is rest, which is also very, very important. And this has to be purposeful. Yeah, it's not a case of flicking through your phone or just zoning out and watching something that you don't really want to watch. This is about active rest, making sure that you are paying attention on being mindful of what you're resting on, not just allowing time to pass by. But anyway, this pyramid falls under the acceptance commitment therapy framework, which falls under the osteopathic philosophy of going towards health. How can we do this in a value-based way? If you're going to have to use your strength, do you want to lift something up, or do you want to punch a heavy bag? Do you want to walk up a steep hill? Do you want to swim? What really ignites your fire? What gets you going? Do you want to do ballet? Like what really gets you motivated? All right. So, and when it comes to rest, do you like reading? Do you like certain novels? Do you like going out for walks? Do you like being out in nature? It's about making this fit towards your values, right? And when it comes to the healthy eating plate, it's the same thing. Diet is so simple when it comes to the basics, right? It's our emotions that make it difficult. I don't want to eat it. I don't like it. I don't fancy that today. I had that yesterday. I don't want it today. I haven't got time. It's the emotions which make diet most difficult. But once again, we come from plants. We come from nature, just like our close cousins, primates, consume a lot of plants. So should we. So when it comes to fruits and vegetables, you're looking at over half of your plate. Protein should be about half a palm size. And then fats, oils, nuts, seeds, etc. should be about a thumb size. And that's what most of our meals should look like. But once again, acceptance commitment therapy is how we can start to make this really, really specific to you and make it bespoke. Now, if we fail to prepare, we're prepared to fail. When it comes to, say, if we did have to, and this is more based on for individuals who do a lot of manual labor, but there's just 3 R's that we can use to make sure that we reduce our likelihood of injury. One, you want to rate how rested you are. If we go back to that spider diagram, individuals who are not rested, sleep deprived, feel achy in themselves, feel a bit irritable, etc., much more likely to injure yourselves in the workplace. Readiness, making sure that you're limbering yourself up, that you're warm before you lift something. And 3, relax. Your body is very, very smart. It doesn't need micromanagement. At the clinic, we see a lot of people who injure themselves because they predict difficulty and they predict injury because of what happened last time. So they tend to tense up before they lift something, and that can lead to you over-contracting and being, over-contracting and pulling something or hurting something. So I hope that was useful. Like I said, what we can do now, if you like, is go through, I'll turn the camera off, and we can go through some, bouncing some ideas off of each other, any areas of your life that you want to improve. We can use acceptance commitment therapy and osteopathic philosophy to see if we can come up with some bespoke solutions, if that's all right.